Hey everyone, welcome back to another episode of Twin Stock Therapy. I'm Adam.
And I'm Aaron.
And we are identical twin brothers with over 30 years of experience in massage therapy, athletic training, and physical therapy. And today's video is all about thoracic outlet syndrome.
And make sure you watch the whole video to see some self-help techniques to help if you suffer from thoracic outlet syndrome. All right, everyone, so we're talking about thoracic outlet syndrome. This is a condition that involves the brachial plexus, which is a bundle of 5 nerve roots coming from the cervical spine down to the first thoracic vertebrae area. But the nerve roots are C5, 6, 7, 8, and T1. They branch off the neck and they come down, kind of bundle together a little closer, and go underneath the collarbone or your clavicle, and they're above the first rib that looks like a little C coming from your sternum back to your neck. And these nerve bundles get pinched on due to respiration and just the space underneath the collarbone and that first rib getting closed off and pinched. You also have a little muscle that helps with collarbone elevation and depression called the subclavius. So if someone has thoracic outlet syndrome that's symptomatic to the point that they've tried some stuff and it's pretty bad, they'll sometimes see a surgeon who will consult with them and discuss cutting out a portion of the first rib just so there's space for those nerve bundles to pass under without getting pinched on. Now, when you cut that first rib out, those muscles that attach, including the scalenes that help with neck rotation, now they don't have an anchor point. They're not connected to that first rib. So it's a means to an end in severe cases, but there's things you can do before that happens to maybe not get to the point of needing surgery and lessening the symptoms of thoracic outlet syndrome, the pain, the numbness and tingling down the arm, so you don't have to go through that extreme situation of having to have surgery and cut out bone and leaving muscles float around when they shouldn't be like that. So as massage therapists or physical therapists or athletic trainers, if they're trained in it, we can do a first rib release, a manual first rib release that will help depress that first rib and to give that space for those nerve roots to pass through that brachial, of the brachial plexus. We forgot to mention during recording that this first rib release technique was taught to us by Lynn and Ann Teachworth through Trunamics. Please check out their website, trunamics.com, in the description. And now back to the video. So what I'm going to do, I'm going to find the point on the neck, drop down onto that first rib, and then I'm going to press down and back on that first rib to flatten the rib down, because muscle tension will lift that up and that causes the issue of closing off that space. So once I push down, find that spot, I'm going to press my fingers in. I'm also going to take some slack off so it won't be quite as uncomfortable to release that first rib. And so from here, Adam, I'm going to have you take a few deep breaths. Typically I'll do 5 to 10. Good. And he will continue to do that for 5 to 10 breaths. And part of the action is for him to try to inhale to the point where he's going to push those fingers up off of where I'm pressing, in addition to me pushing down and back on there. From here, Adam's going to take over and show some self-release techniques to help with muscle tension in that area to help with thoracic outlet syndrome. So next we're going to show some exercises you can do at home to help yourself.
All right, so we're going to go over some exercises you can do on yourself at home to help if you have thoracic outlet syndrome. But before we get started, I just want to mention none of the exercises we show is to be used in place of medical advice from your primary care physician. So please check with them before you do any of these exercises just to make sure it's safe to do. So the first exercise we're going to do is some pretty simple stretches. I think we've covered them before, but Aaron's going to take his right ear to his right shoulder, and he is going to reach over top and accentuate that stretch by pulling on his head. And this is stretching this side. We're just going to show the left side for time purposes. But then when he gets about 20 seconds of stretch, he's going to release. You do about 3 for 20 seconds. Then he can also do a different angle and take his nose towards his armpit, and he can pull down. And if he wants to accentuate it even more, he can always reach back with his other arm, because that's going to put stretch on the front of the shoulder. All right, and then lastly, Aaron's going to create a web with his two hands together. He's going to put that on each side of his neck, and he's going to be pushing down on the collarbones. Then he's going to pull down and create some drag on those muscles, those anterior neck muscles that are involved with thoracic outlet syndrome, that get tight and pull that first rib up. And he's going to look up to accentuate it. He's going to breathe nice deep breaths and hang out there. Do this for like a minute to 90 seconds, and then do 3 sets of these, really as much as you want until it feels loose. And then lastly, to accentuate it a little bit more, he can turn his head side to side with his chin up. And now he's getting all those vectors, all those angles, hitting all those scalenes, getting a little bit of SCM in there. And then that will help free up those muscles and help improve blood flow and create more space so that there's no pinching on those nerves, or at least significantly less.
All right, everyone, we hope you really enjoyed this video to help with thoracic outlet syndrome pain. Be sure, if you haven't done so already, please like this video, click that subscribe button and the bell notification so you're notified anytime we release a new video.
And if you want to see us do particular subjects on videos, leave comments in the comment section about what you'd like us to do, or if you want to email us privately at our email account, it's twinstalktherapy@gmail.com. Let us know what you'd like to see next. I think that wraps this episode up. Thanks for watching, and we'll see you next time.